Joining me now by phone, a man currently managing this crisis in what has become the epicenter of the pandemic globally, the governor of New York, Andrew Cuomo. Governor, thank you for making some time. I want to start on the ventilator issue. The president seems to think that the estimate of needing 30,000 ventilators, he feels it's too high, that you're overestimating how much you're going to need. What's your response to that?
Well, Chris, listening to your lead-in, and thank you for having me. You're exactly right. This all comes down to ventilators. And by the way, it did in China, it did in South Korea, it did in Italy, and it did as soon as the numbers started to break here. And it is unusual. The number of ventilators we have in our healthcare system, when you add up all the hospitals in the state of New York, is about 4,000. We need about 40,000 here. This is a disease that is a respiratory disease. People are on respirators, the ventilators, and the ventilators are a matter of life and death. And they're on ventilators longer with this disease than most other diseases. The average length of stay on a ventilator is about 4 to 5 days. Here it's about 20 days. Which is one of the reasons why you need so many. The president says 30,000 sounds high. I don't know what the basis is. I don't have a medical degree, so what I do is I just study the numbers and the science and the data, and I follow the data. We have McKinsey & Company. We have Cornell Weill Medical Center. I talk to the World Health Organization. You look at the models of China, look at the model of South Korea, look at the models of Italy, and look at the models of the numbers in my state. You see it takes you to 40,000 ICU beds with ventilators and 140,000 hospital beds. That's what the numbers say at Apex. So I plan by the numbers, and I don't know how to do it any other way, Chris.
Where are you right now? I think I know when this went into it, you said the state had 4,000. I think there was maybe another 7,000, some of which did come from the federal government. Like, how far are you from what the state needs right now to handle that peak if it comes at what the model suggests?
We're scrambling to buy them all across the globe. One of the things that has happened here, because the states were left on their own to purchase, in a cruel irony, the states are bidding against other states, Chris, for the same materials, and they're actually bidding up the price. So I'll get an order for ventilators, and I'll have a company say, I'll send you 5,000 ventilators in 3 weeks. And then they call me back and they say, sorry, I sold them to Illinois or California or Florida. That's the situation we're in. I need about 30,000. We're about halfway there, counting orders that we have. We've gotten 4,000 from the federal government. I had 4,000 in our hospital system. We bought about 7,000, and then we have a scattering of orders which may or may not come in. One other point on something you mentioned. I applaud the president for using the Defense Production Act. I said last week he should have used it. This is not a time to be bargaining with corporations or relying on the voluntarism of corporations. We need these ventilators, and we need them now, not when the corporation decides it's convenient for them to do the design and to put a new line in operation. You're talking about my possible apex is 14 days away. If I don't have the ventilators in 14 days, Chris, people die.
You know, that strikes me as part of the difference in which governors, I think, across the ideological spectrum generally, and the president have approached this, which is a kind of planning for the worst and hope you're wrong, right? So if you get too many ventilators, what's the worst thing in the world that happens, as opposed to planning for the optimistic case scenario and erring on the other side? Like, what are the stakes if you're wrong in the wrong direction for people in New York, sick people in New York?
Yeah, no, you're exactly right. The difference is somebody who's been out there and somebody who's been through it and somebody who hasn't, right? I used to be in the federal government, as you know. I was HUD secretary, and I've done floods, hurricanes, all sorts of disasters. Yeah, maybe you send out too much equipment. So what? The real crime and the heartburn is if you have too little. So, and I'm not even taking an aggressive model. I have a reasonable numeric model based on our numbers. And again, you have a whole world of data going back to China. And we're just asking for what we need for our reasonable model. I'm not, because many of these I'm paying with state money. And these ventilators, they're about $25,000 each, Chris. So I'm not eager to buy more ventilators than I have to.
Right. You had been a critic of the relief bill that has now been passed and signed because of precisely the issue you're articulating here. Whether there was sufficient money for the state. Obviously, all these states are scrambling. They're going to be paying out of pocket for all these things, as they should, these emergency funding. Less money is going to be coming in taxes. Every state's going to be walloped with a deficit. Do you think what came out of Washington today is sufficient for the kind of hole that New York's going to be looking at?
No, it's not even close. Look, the bill, they all applauded themselves. The bill did a lot of good. The unemployment insurance is good. The small business aid is good. The health care aid is good. But they left out a very important function, which are the state governments and the local governments. You know, my economy is shut down like everybody else's. I have no revenue, and all I have are expenses. And none of the aid went to a state government. Now, it's not like it's my money and I'm going to go out and buy something. If you starve the state government, what I fund is education, and I fund health care. Right. So when I have no budget, Chris, it means I have to turn around and cut schools all across my state and cut health care all across my state. It makes no sense. Now, you know, states don't have a voting constituency, right? You can't come and hand me a big check. So it's not as politically advantageous when you do a bill in Washington. But I think it was short-sighted, and I think they say they're going to come back, but, you know, who knows?